Joining me now, General Rick Hillier. He is the head of the COVID-19 Vaccine Distribution Task Force in Ontario. Thank you, sir, for joining us today. Always appreciate your time.
A pleasure to be here. Thank you.
Let's start first with the question that many people are asking. Over Christmas, there were some shutdowns of the vaccination program in Ontario for 2 days. Where did you get the advice to close down for those 2 days?
We got it from a variety of sources, all very well-meaning and all intended on to make sure that the program could be ready to roll forward with the utmost energy immediately after that time, which it is now doing. And the idea is that in those long-term care homes where we are trying to get the healthcare workers and the essential care workers and the essential visitors to those homes to come to the vaccination sites that we've set up and get vaccinated and therefore protect the residents, that during the Christmas timeframe, a lot of them were on reduced staffing. They can't take them all away, obviously, at any one point in time. And because of that reduced staffing, people are trying to get a little break and a little rest. And we felt maybe if we didn't prevail upon them and didn't demand too much from them over those 2 days, we could actually start with renewed energy yesterday. And that's exactly what's happened. We're now back rolling and we're getting ready to rock and roll. We had 13 sites running today vaccinating. We'll have 19 sites tomorrow. And by next week, we'll expand to 21 sites and then go onwards and upwards from there. So got a variety of sources of advice, all well-intentioned to trying to make the program in the slightly longer term better.
So you say it's staffing issues. Let me just play a clip from you, from an emergency room doctor we spoke with earlier. I want to get your reaction to that.
I don't think that this virus takes weekends or holidays off. And I know how dedicated the healthcare workers are in this province, that they would be there to vaccinate at all hours. So let's make it happen.
So he was saying that there would have been people to give the vaccine. What is your response to what that emergency room doctor had to say?
I'm delighted with what he said, and we wait to count upon he and all his colleagues to step up after their shifts, and that's what they've been doing, God bless them, and to do even more. What I was talking about were the staff working in those long-term care homes, Anna. Those have been going for 10 months flat out in a stressful environment. They've been carrying the heavy load in times of tragedy. And their supervisors obviously felt by reducing staffing a little bit over the Christmas time, they could give them a bit of a break. And that was not the time to sort of be asking them to give up most of a day to come in for a vaccination. And we'll pick them up yesterday or today or tomorrow. And that's exactly what we're doing. But yeah, we know lots of the medical professionals, and they are incredible. They are incredible, will volunteer their time. Many have already done that. I've met them in Ottawa, I've met them in Toronto, and we'll want more from them. So yeah, I'm with him. Let's get rolling. And that's exactly what we're going to do now.
Now, correct me if I'm wrong, your commitment was to get 90,000 vaccines distributed by the end of the month, which is Thursday, correct? How do you plan to do that?
No, our commitment was to receive those 90,000 vaccines. We think we'll have the vast majority of them done by then. Some of the hospitals will be keeping an eye on the second dose, so they might not use them all. They have that flexibility without question based on their good decision making at the lower level. And what we're saying is, as we get more confidence in the system of delivery of the Pfizer vaccine, as we know when the vaccines are coming and what numbers of doses are coming, we can actually start saying to the hospitals, hey, go ahead and vaccinate using all that you have, and we're confident for the next 3 or 4 weeks that we will have vaccines to follow. We're not yet there 100%, but we are pretty close to it.
How many vaccines does Ontario have right now, of both the Pfizer-BioNTech as well as the Moderna?
First of all, we have no Moderna.
Okay.
We expect to have some by the end of this month, and we look forward to that, certainly. But in Pfizer vaccines, we've had 95,000 and somewhat delivered to us, so almost 96,000. We've vaccinated more than 13,000 people in the province of Ontario. We're going to use the rest of those vaccines to do exactly that, vaccinate the people of Ontario. Starting on the 5th of January, just by the way, we're going to have people coming back now for their second dose. So we want to make sure those vaccines are available for them. The flow looks to be really good. We're happy with that. We're putting in place an expanding program to be able to do more and more and more every day. In about 2 weeks, maybe 2 weeks and a little bit, we want to be able to do 12,000 vaccinations a day, and then start that first part of the program really rolling at a good speed, and then ramp up to the greater doses that we expect to see in in late March or April, May, and June, when we will see millions of vaccinations taking place across Ontario. So, we started, we've learned some lessons. Okay, we stumbled once or twice. That's to be expected. I kept saying we'll hit some road bumps, but we'll be better on the other side of the bump.
Stumbled
Well,
where?
Just in learning a whole variety of things, but how to set up our vaccination clinics, how to reach out to people, how to get them to record or to reserve a spot in the vaccination process, how to make sure that we record it, that they had a vaccine, and of course, how we communicate with the people also. We want the long-term care health workers and essential workers and the workers in those zones. We want them all to want to be vaccinated, because we see that as a sure way of protecting both them and the people that they look after so well. And so we've got to communicate with them better so they understand, the vaccine, they're not afraid of it, and they understand that the vaccine is what they need to protect them and the people that they watch, the patients that they look after so tenderly from COVID-19. And so we've got to communicate better ourselves also. So we're learning as we go, quite literally.
And Moderna, you say you hope to have some vaccine, and that would be by Thursday. How many doses do you think you might have by Thursday?
And
they're going to long-term care homes in Ontario, correct?
Our number one focus is the long-term care homes, and this using the Moderna, and we expect that by the end of this month, obviously by Thursday and or Friday, we'll have somewhere around 50,000 vaccines or doses of the Moderna vaccine. We look forward to that. It gives us a bit more flexibility in being able to move it. One of the questions we want to know, because we want to start looking, yes, in addition to those long-term care homes and the residents in those hot areas, in the red areas, in the lockdown areas where the tragedy has been horribly visited, there's where we want to go first. We also have started looking at now the isolated communities across the north, and some in particular that most at risk along the James Bay area, and some of the long-term care homes in those small communities, and how we want to be able to use Moderna very early on to be able to protect them, because they live in most vulnerable circumstances also. So Moderna, coming the end of the year, 50,000 doses, and we want to get it in, and we want to start vaccinating in those locations because we can move it. One of our first questions, of course, is can we move it when it's thawed, when it's in a liquid form? Can we put it in syringes in a sterile environment in a hospital, and then ship those syringes out to the homes or indeed into the north, and be able to have that ease of vaccination by simply using an already prepared syringe, as opposed to having to thaw it and dilute it and then put it in a syringe yourself? Those are the questions we're working with right now, and we'll answer them all, and we'll get to it, and we can't wait, because those are problems that we love to have, because we want to solve them for the people of Ontario.
I want to pick your brain just quickly. I'm totally out of time, but I'm going to ask you anyway. Is the AstraZeneca, we heard that that's going to be approved in the UK soon. Have you heard anything about that? Because you did give us the Moderna news ahead of everybody else.
Anna, I have not heard anything about the third vaccine. I keep saying to our team, okay, one of the things we had to be ready for here is all of a sudden we get a massive amount of vaccines available to us in January or February that is not predicted right now. And we want to be ready for that. So if we're a little slow here going right now, and I'll take blame for that, I'll take the responsibility for that, because I wanted to make sure we learn the lessons and get our operation squared away, so that if these things happen, we get a third vaccine, all of a sudden we get a whole bunch of doses of it, we can be prepared to take it and use it really efficiently and really fairly for the people of Ontario. I'm sorry, I can't say to you, I've heard it's going to be days or weeks. I wish I could. Maybe if I said, I think it's going to be days, maybe then they would speed up the process or something. But no, I don't want Health Canada to shortcut their process. No,
absolutely. And just finally, you're not shutting down vaccinations for New Year's, correct?
We will have vaccinations over New Year's. They'll be much reduced in scale and scope for a whole variety of reasons here. But we're going to keep rolling now through, till we're finished this vaccination program here. And look, we're in January, February, the rest of December, January, February, and March, we're going to do a lot of the people in Ontario that are in those vulnerable circumstances, in those long-term care homes, in retirement homes, and of course in those communities across the north, as I mentioned to you. We're going to do healthcare workers. Many times those two priorities will blend, because healthcare workers work in long-term care homes. Healthcare workers are also in vulnerable circumstances, and we would like to get to those that work with COVID patients and are most at risk, as soon as we possibly can. We want to get the vast majority of that done by March, and then we want to be ready for the big vaccines. We see like 5 million a month arriving in Ontario, April, May, and June, and we want to be able to roll that and look after essential workers and look after our age groups and look after those who are in very vulnerable circumstances, perhaps in neighborhoods and perhaps in certain demographics of our population, but do what's right by all of those groups. In April, May, and June, we want to be ready for, a massive program that requires all hands on deck. And so if we're slow rolling out the door, that's why. We're ready to rock and roll now, however, and we want to help make 2021 a much brighter year than this dark 2020 has been.
Absolutely. General Rick Hillier, Happy New Year to you, and thank you for your time today. We appreciate it.
On a Happy New Year to you also. Thank you.
Thank you. General Rick Hillier is the head of the COVID-19 Vaccine Distribution Task Force for Ontario. Of course, he's also a retired general and former Chief of Defence Staff for the Canadian Armed Forces.